are probably the only country on the planet that we want to cover everybody and we want to cover everything.
Yes.
And that is a noble goal, because there is certainly nothing more precious than a life. We're not going to argue about that at all.
Right.
But obviously there is a cost to that philosophy.
Right.
And that's what we're seeing. You know, you bring up a good point. I do tell people every now and then when they are complaining about their health insurance premiums, and admittedly, the cost of health care is high, therefore health insurance premiums are high.
Yep.
We'll just get that out there. So, but I asked them, I said, would you think for 1 minute to go get your tires rotated and then bill your insurance company for it?
Right.
Of course, they laugh. And I said, okay, well, think about this. You can go to the doctor and get a checkup and the insurance company pays for it.
Yeah.
What's the difference? Of course, the difference is you're talking about somebody's life.
Right.
So that gets to your point of, you're right, it touches everybody.
Yep.
Would bid on Medicare Part D.
Yep.
And some of that, if your prescription drug company is big enough, you control a good amount of the regional benchmarks, things like that. And then if you have good research folks on your team, and marketing folks, you can start to make guesses about what the other companies that you're competing with in these spaces are doing. And so you have a level of confidence where you might know what's going to happen in a certain region or a certain state, but you're not 100% certain. And if in MedD, if you miss the bid, you can lose a large number of your population that you work so hard to get over the years.
Right.
So it's a little bit of a gamble. And the key thing I found there was to explain to everybody, well, here's how confident we are in where we're taking this on this bid. And if we miss, this is what it means to the company. If we win, this is what it means.
Interesting.
And then there's this middle area where you're trying to really cut things close.
If you like the business side of it and you like there's right now with the ACA, the Affordable Care Act and things like that are changing healthcare so drastically. I mean, the Association Health Plan regulation just came out yesterday. So now I got to read that to see how that's going to affect our insurance the next year, which is part of I love policy work. Health insurance is a great place for that. So it just sort of depends on the level of technical work that you like, as well as if you're interested in health insurance. I've always been interested in the medical field.
Yep.
I worked with doctors for a while at Milliman. I even went and watched an open heart surgery in the operating room.
Did you really? Wow.
Yeah, and I was able to stand there for a whole half an hour before I started feeling sick.
I struggle in hospitals.
Yeah, but so if you're passionate about black lung disease or something like that, that's one of the casualty things. If you're passionate about the planet and the environment changing, maybe casualty also is something you should think about. If you're passionate about health care, health insurance is a great way to use your capabilities and actually have an opportunity to affect people in healthcare. So then you should be maybe in health insurance.
As have I been and continue to be, and a number of others, very involved with the Academy of Actuaries on a volunteer basis, which, as you know, and maybe perhaps most of your viewers know, handles public policy for the actuarial profession.
Right.
So, I developed through volunteering with the Academy starting many years ago. I developed an interest in health policy and government regulation and the impact on insurance markets and on the U.S. healthcare system generally. So that's what I have wanted to continue to do, and Wakely has afforded me that capability.
Opportunities in health, constantly changing with the political climate, and new things are constantly getting passed or need to be reevaluated. So honestly, there's a lot of growth in health. So I wouldn't change it now, even if I could go back and change which field I went into.
Yeah, no, that's awesome. I mean, I've found that like a lot of people, they'll kind of choose their route based on what their first job is in. But I do think that, I mean, me being on the health side as well, that's where my experience is. I feel like there's a ton of opportunity on the health side, and it's a little bit newer than some of the more traditional type actuarial roles like life insurance, property casualty. I mean, health has been around for a while. It's just that actuaries maybe haven't been involved as long as some of the other fields. So I think it's pretty interesting.
Yeah, and the constant changes are an opportunity for actuaries. Risks need to be quantified, evaluated, and there's just definitely room for growth.